Reviewing the scientific literature to answer your questions about gender diversity, this is Classroom Psychology. And now here's your host, Dr. Cora Sargent.
Hello everybody and welcome to Classroom Psychology. I'm your host Cora. Thank you so very much for joining me. It is wonderful to see you. Welcome to 2025. How did we get here? Donald Trump's about to become president. How did we get here? But it is wonderful. Listen, it's wonderful to see you. And while the world continues to change, isn't it wonderful that some things never do? As we come back together to take the confidently declared statements of public figures and politicians and probably the President of the United States, and we take their confidently declared statements for the questions we're sure they were intended to be, and we see if we can't look to the literature to find an answer together. And this week is no different, although maybe it is a little different, because François Brizan and his many colleagues published new guidelines in the Archives de Pédiatrie in France, the new sort of French guidelines on the treatment, the endocrine, the sort of hormonal treatment of children and young people who are gender diverse. And it's super fascinating. It's sort of pitched against the Cass Review. It's like the French equivalent of the British Cass Review, and the Cass Review has sort of found its way across the world, really, and has been met with kind of mixed reception around the world. The Yale Law School published an evidence-based critique of the Cass Review. The Royal Australian and New Zealand College of Psychiatrists rejected its implementation in Australia. And there have been a bunch of people, ourselves included, offering a little bit of a critique of the Cass Review. My own critique, I think the Cass Review is fundamentally the challenge is in the systematic reviews that inform it. Now, those systematic reviews are really good, but they do make a couple of key decisions, especially kind of removing a lot of the low quality and inverted commas evidence that might otherwise have helped them to make some more, some more affirmative choices in how they interpret the literature. If you exclude a lot of the literature, if you create a context where the literature creates standards against which this field of literature can't really stand up, if you're interested, go take a look at our 3 episodes on the Cass Review as we do a bit of a deep dive critique. But the cliff notes are, they make some big choices about removing the low quality evidence, and that creates a standard against which this field of research can't really stand. It's not, we aren't like drug companies. We don't have huge amounts of money. There's no grant funding really. No central governments are funding research really into the trans community, not on any grand scale, and so it's largely just small groups, teams of people just with a vested interest trying to, we're rogues. We're rogues. We're a sort of, a ragtag bunch of renegades trying to do our best to do this research. We're not super well-funded, massive kind of teams. And so it's very difficult, and it's a very small community. So to invite the kind of standards of research that are usually used in drug trials, a bit tricky to apply them here. This is a very small group of people who we're looking at. There's often only one clinic in any individual country that supports that community. So when you sort of mark studies down on quality for having only one site, which is very common in kind of bigger studies to mark down studies that use only one site, for example. But if you've only got one clinic in the country that's supporting the community, it's very difficult to do multi-center trials, So, but essentially, the Cass Review had some problems, primarily because it restricted the sort of use of the lower quality literature. Also, I think made some errors, a couple of errors in how it interpreted that literature, and in 1 or 2 places were just flat out wrong. But we're all human, and we will make mistakes, and that's kind of the point of good science. Really, is that in the context of the Cass Review, we then have a bunch of scientists saying, actually, there are problems with this review. And then we have other researchers like Françoise Brizan and colleagues putting out their own research that basically is an alternative to the CAS review. Now, this is a completely different way to report on pediatric medicine. The CAS review itself wasn't published in a peer-reviewed journal, so it wasn't peer-reviewed. And that is understandable because the systematic reviews that informed it were. So it doesn't really matter that the CAS review wasn't, but it does mean that the review itself didn't go through a peer review process in the same way as you might expect in a publication that goes through a scientific journal, whereas these guidelines were published in the journal Archive de Pédiatrie. God damn it, I practiced this. The Archive de Pédiatrie. Yeah, there we go. So they published in a pretty cool journal, and of course were then peer-reviewed. But under the hood, they don't review the literature in quite the same way as the systematic reviews do. They don't transparently consider their methodology. They don't make their methodology for how they reviewed the literature, how they chose the literature that they were going to review, transparent. So it's a mixed bag. It's quite difficult for me to interpret how they reviewed the literature, because they don't make the methods through which they reviewed the literature, the search terms they used, the engines they used, kind of how many studies they got back, and the criteria they used to exclude studies. They didn't make that clear at all, which is, fine. It's a different way of doing the science. This is more what you would see in a published scientific study that isn't a systematic review. They often will review the literature as part of their process, but they don't make transparent how they review the literature. It still gets through peer review, right? So it's fine. And importantly, one of the main kind of criticisms of the CAS review was that Hilary Cass and colleagues were not experts in transgender healthcare, and weren't experts in the support of children and young people who are gender diverse. And that meant that it sort of created a problem in trusting how they were interpreting the literature, the data, right? So one of the challenges I think that we have is that the University of York that conducted the systematic reviews weren't experts in transgender healthcare and made decisions in the systematic review process which were not decisions that a transgender scientist in this field would make, because anybody who understands this field well knows that you can't really hold the field to the same standard as you would for drug trials, for example. It is a bit of a problem, I think, in the whole review that they didn't have experts in transgender healthcare writing it and making the kind of key studies in how it's conducted, or the key decisions in how the studies were conducted. Whereas Françoise Brizan and colleagues are indeed experts in transgender healthcare. And so, they work with gender diverse children and young people. And so their work is better informed from their own practice and their own expertise, which I think is helpful. So in one sense, it's quite difficult to know how the work was informed because they don't make because their reviews of the literature are not systematic reviews. They don't make the methods transparent. On the other hand, their sort of expertise is more trustworthy, whereas the University of York and the CAS review, their expertise, not to say their expertise isn't really good. They have amazing expertise, but it's not necessarily exactly relevant expertise here. Expertise in systematic reviewing, wonderful to see, really important that you get those folk in and doing this work. But if they were experts in transgender healthcare, they might have made different decisions in how they reviewed this literature. So, it's just a very different way to approach a review. But in the review that they create, the French review is much more focused on affirmative healthcare. So they don't just focus on the higher quality evidence in inverted commas. They focus on the highly relevant literature, even if it's a little smaller in scale, and they draw conclusions, I think, from that. I'm reading between the lines slightly when I'm reading the French review because again, you can't actually know how they did the reviewing of the literature because it's not a systematic review, so it's not transparent in that way. But as I'm reading it, it looks like what they are doing is focusing on the very relevant literature and considering that as the most important, even if it is of a sort of, in inverted commas, traditionally lower quality, right? It's going to have smaller scale. It's going to be at a single site, potentially. It's not going to have the kind of high, robust, rigorous sort of longitudinal, prospective designs that even randomized controlled designs that you might see in other fields. And instead of excluding those studies because they weren't as high quality, they included them because they were more relevant, because they're focused specifically on their community. There's one particular kind of area that I think is really interesting, and that's the area I'd like to focus on today. We're going to grab a comment from a public figure in a second to focus us in. But the thing that I'm really interested in is the conclusions that they make about pubertal suppression on IQ. And I think that it sort of evidences something of what these French researchers are doing, which is to say, listen, there are only maybe 2 or 3 studies in the world that look at the effect of pubertal suppression on IQ in gender diverse populations. There are a few more that look in young people with precocious puberty, but these guys really focus on the most relevant to gender dysphoria, those focused on gender dysphoria, even if the quality isn't quite as good. And they lean quite heavily on a key study from Arnoldson and colleagues that looked at the impact of IQ before pubertal suppression on educational attainment after pubertal suppression. And I'm not sure that evidence can quite carry the weight of the conclusion that these researchers are drawing. We will get into it a little more. But essentially what these researchers are saying is that there isn't a relationship between, there isn't an impact of pubertal suppression on educational attainment, and they use Arnoldson to evidence it. And that's a sort of microcosm of the wider review, where what I think they're doing is focusing on the really key studies that are very relevant to this population, to the exclusion of the wider literature that is less relevant but might be slightly higher quality. Again, higher quality in inverted commas. I realize I'm talking in a lot of terms here, but what this basically says, given that sort of broad critique, the French review highlights that young people who are gender diverse need access to hormone blockers, need access to gamete preservation and fertility treatments, and they need access to non-hormonal support, including support with binding, support with tucking, and support with making sure that they manage their sexual health. And they need support with broad transition-related healthcare in all kinds of different ways. And the French review highlights that there are lots of different areas of medical healthcare that transgender young people need access to. And it gives really a step-by-step guide of how clinicians can support basically trans youth. Now, what is really interesting is that the French review is quite critical of the watchful waiting approach, which is the approach that England takes, right? The watchful waiting approach basically says, we need to delay access to these kind of healthcare options while young people demonstrate they are certain about where they are. And the French review is quite critical of this approach. So they say that uncertainties do exist around the long-term treatments of hormones, like hormone treatment effects. The long-term medical and psychological effects do need to continue to be evaluated. But they say, on the other hand, every new therapeutic proposal in medicine, and particularly in pediatrics, raises the question of the absence of long-term data. Moreover, a wait-and-see attitude in adolescence does not reduce psychological distress, increases the risk of committing suicide, and can affect psychoaffective, and cognitive development. And they produce a bunch of literature that we've already reviewed in other episodes. At the extreme, conversion therapies have been scientifically proven to be harmful, and these have been banned in France since 2022. We've done an episode on conversion practices, and in the UK, they still are not banned, amazingly. Medical support is now an option that should be considered in a personalised approach that takes into account the needs of each young person without a predefined protocol. Nevertheless, for a field that has such an impact on the future adult, hormonal transitioning in trans youth has been the subject of relatively little academic research until recent years. It is therefore essential that professionals supporting these young people work together at national and international levels to accumulate prospective data in order to provide these young people and their families with the most enlightened information as possible. The French Review suggests that we move at the pace that is right for children and young people, that we should not engage in a wait-and-see approach, and that such an approach, which is the approach that England has used for some time now, can increase psychological distress to the point that it increases the chance of people taking their own lives and can affect psychoaffective and cognitive development. So we have, when they say it can affect psychoaffective and cognitive development, they are being very deliberate, I think, in their choice of language. Because today, I would like to look at the impact of particularly hormone blockers and then gender-affirming hormones on the cognitive development of young people. Because this is an interesting field, and I found, my friends, some interesting results. So let's take a look. But before we do, we need to hear from our speaker today. So today's question comes from a very cool researcher. Dr. Sally Baxendale is a professor of clinical neuropsychology at UCL, Queen Square, in the Institute of Neurology. She is 3 decades of clinical experience. She's published in The Lancet and the British Journal of Medicine in neurology. She's the author of books. She's frankly impressive, deeply, deeply impressive. And she's absolutely brilliant. I admire her a great deal. So we're going to treat her with the greatest of respect as we hear from Professor Sally Baxendale.
In terms of conclusions, I didn't find the kind of Nobel Prize winning, guess what, actually you can pause a developmental stage and then restart it and everything will be okay. I didn't find anything because there's just no evidence out there. And I think that's the kind of key take home from this is how has this been allowed to develop as a treatment when we know so much about brain development and stopping puberty and what happens in puberty. And we can kind of predict that cognition is going to be really, really important. How has nobody been looking at this? All of the thousands of patients that have gone through this treatment, I think it's a medical scandal. That's my particular point of view.
Thanks so much to Professor Baxendale for such an interesting question posed, as they often aren't, honestly, quite boldly, but I have a great deal of time for Professor Baxendale, and I am fascinated by what she had to say here. She's speaking at the Society for Evidence-Based Gender Medicine, and obviously the Society for Evidence-Based Gender Medicine, to those who know, I don't really know how to describe them, except they're quite critical of gender affirmative approaches, particularly when it comes to trans and gender diverse children and young people, whom they describe as gender questioning youth. Professor Baxendale talking at such a conference, it's not a conference that I would speak at, but then it's not a conference that they would invite me to speak at. Who are we kidding? So thanks so much for Professor Baxendale. I do have a great deal of time for her work, and her systematic review in this field is one that we are going to lean on heavily because it is very, very interesting. It's very well put together, of course. And the question that she seems to be asking, the question that I think is at the heart of what we need to talk about, is do hormone blockers influence cognitive development, particularly I mean, because it's the only question that we can answer, because there's so little evidence in this field. It is kind of startling. I do think the first thing I can say is that Professor Baxendale is right, that there is not more evidence around this question is kind of shocking. Not because, I mean, I realize that Society for Evidence-Based Gender Medicine is focused on the treatment of gender diverse youth, but the treatment of gender diverse youth is tiny, bearing in mind that a Freedom of Information Act request of the NHS revealed that only 88 kids were on, like young people were on puberty blocking medication in an entire year. So it's a tiny group of people, but there are far more young people who have precocious puberty, puberty that's a little younger than you might anticipate, sometimes quite a lot younger than you might consider typical. And therefore, those young people often will go on puberty blocking medication. And that there is no evidence around the sort of cognitive impact of pubertal suppression when it's used much more prevalently for that community is actually pretty shocking to me, particularly given what Professor Baxendale's point is, which under the hood is basically that there is reason to consider that puberty blocking, like pubertal suppression, GnRH agonists, could have an impact on the intellectual development, the cognitive development of young people engaging in them. Now, we focused a lot in the first kind of 10, 15 minutes of this podcast. We focused a lot on the difference between France and England. And the reason for that is because this difference is extremely relevant in how we interpret Dr. Baxendale's work and the conclusions that she draws, and how we're going to draw our own conclusions as we look at this literature fresh. But even the conclusions that we are going to draw, which are going to be quite nuanced and may not be what you're expecting, but I think if you go down the French route, if you are not engaging in watchful waiting, I think the interpretation of this evidence is very different. The sort of implications of this evidence are very different if you are not engaging in a watchful waiting approach compared to if you are. And I think that's maybe why, at least part of the reason why in the UK right now, puberty blockers have been banned and they haven't in France. In part, I think, because the UK is using this watchful waiting approach. So I think the critique we are going to land on is not a critique of puberty blocking, but rather a critique of the watchful waiting approach. I say this because for a time, you and I are going to get into the weeds a little bit. We're going to get to some nuanced places in the kind of things that we are finding when I'm reading this literature are a bit interesting and maybe not what you're expecting. So let's take a look. And the first thing to say is that puberty is actually really good for cognitive development, and the timing of puberty does have an impact on IQ, does have an impact on cognitive development. It changes kind of how somebody's intellectual development progresses. So Shirazi and colleagues in 2020, timing of pubertal steroid exposure. The timing of peripubertal steroid exposure predicts visuospatial cognition in men, evidence from 3 samples. Peripubertal steroid exposure are basically the hormones of puberty, right? And what they find is that pubertal timing does change a person's brain development. So in this study, which did a bunch of experimental studies and brought together a meta-analysis, they found that earlier gonadal hormone exposure leads to basically visuospatial cognition improvements in young men. And they think that that's because essentially the timing of the steroid exposure changes how the brain responds to the presence of hormones. That brains gradually, the central nervous system over time, over the period of a young person's life, becomes less susceptible. Like it is affected less by the hormones of puberty over time, which is fascinating. And they found that the kind of more sex-typed cognitive abilities, like visuospatial cognition, is supposed to be like better in men generally, and they find that the timing, not the greater hormone levels, like greater hormone levels not associated, but the timing of the hormones. So if you receive them earlier in adolescence, you have stronger visuospatial cognition as a consequence. So they're saying really interestingly that essentially brains do get affected at different ages differently by sex hormones. So not only does the act of engaging in a puberty change your brain development, but the timing of that is really important. And that, I think, sets a context for us thinking about both kind of precocious puberty, where you're experiencing puberty before you should be, in inverted commas, before is typical, and for like gender diverse folk, transgender young people who in the watchful waiting approach are on hormone blockers for longer and then experience puberty much later when they finally get access to gender affirming hormones when they come of age. So a huge difference between those two groups. And the question is, for either people with precocious puberty who engage in the use of puberty suppression in order to delay puberty until they reach an age of typicality, and for gender diverse youth in England in particular, who engage in puberty suppression until later than is typically the case for people, because essentially the watchful waiting approach says, well, we don't want to give you gender affirming hormones until we are sure that you want to go down a puberty that is right for you. Like, we don't want to do that until you are absolutely certain, so we delay it until later. So for either of those groups, does pubertal suppression impact their cognitive development in some way? There's reason to believe that it would, right? Given that meta-analysis, does it? Let's take a look. So I looked for all the studies I could find, and Baxendale basically did exactly the same thing. I did this separately because I wanted to see if I could find anything that Baxendale didn't, which is pretty narcissistic of me. She's a professor and I'm just like a senior teaching fellow, but maybe I find something, but no, I didn't. There are only 5 studies that I could find that looked at, so Baxendale did this huge systematic review, but the majority of the studies that Baxendale found were not human studies. They're all like animal and primate studies, and I am not that kind of doctor. I can't tell you whether or not those animal studies translate into humans effectively or not. I don't know. Go check out Baxendale's original research if you're interested to find out more. I'm going to largely ignore the animal studies because I just don't know how well they translate. I'm going to focus on the human studies. So I could only find 5 studies that looked at intellectual functioning as a consequence of hormone blockers for either people with precocious puberty or for people experiencing gender affirming treatment. The first is by Mull and colleagues, psychological assessments before and after treatment for early puberty in adopted children, published in 2001. So this is a long time ago. This is what I'm finding, you and I are going to get into this together, but my goodness, this field is so weak sauce. It's so weak. Where is the studies? There are no studies, you guys. There are no studies that I can find. Which is kind of shocking, I think. One of these 5 studies was conducted 25 years ago. It's interesting. So the children in this study, they were born in India, Sri Lanka, Colombia, and Korea, and they were then adopted by Dutch parents, which is, problematic in and of itself, but we'll try and glance over that for a moment so we can look at the actual results. These children were all young people who developed early puberty, which meant that they were experiencing pubertal development between the ages of 7 and 10, much earlier than you would expect young people to develop puberty, right? Now, after assessment for treatment, 30 patients, that's 27 young girls and 3 young boys, were eligible candidates for the study, and they entered into the treatment protocol. That's 12 from Sri Lanka, 9 from India, 7 from Colombia, and 2 from South Korea. 2 of these girls had already experienced their menarche, their first period. And they were ultimately kind of randomly assigned to two groups. They were testing the difference between two different treatment approaches, basically. Either the GnRH agonist triptorelin, which is decapeptyl, or in combination with a human recombinant GH, genotropin, in group B. So they were randomly assigned to the two groups. It doesn't really matter for our purposes, I think, which group they were in. Now, what's important for our purposes is that they used the WISC, which is the Wechsler Intelligence Scale for Children, and they delivered it at time 1 before they received treatment and at time 2, 3 years after initiating treatment. And that gives us an IQ score. Now, y'all, if you know me, you'll know that I'm a bit critical of IQ when used with individuals, but I think it's really valuable when we use it with groups for research, because it does give us a sense of the kind of broad intellectual functioning of young people. It only measures what's measurable. It doesn't measure a bunch of stuff. We're not going to get into the weeds around that. We're just going to take a look at what is available to us, because it's the only cognitive development measure that these researchers took. But they did take time 1 and time 2, bearing in mind, not a huge sample, like 30 people, right? It's not a lot of people, but it does give us a bit of a sense of what the impact of these puberty blocking medications were over the 3 years that they received them. And they found that it did have an impact on IQ. The total IQ for the whole group at time 1, that's pre-treatment, they had a verbal score of 9.08 roughly, a performance score of 11.48, and a total IQ, which has an average in the population, right? These are kind of norm reference tests. The total IQ 100.2, which is exactly what you would expect to find in an average random population sample. An average of 100.2, standard deviation of 12.7, that's completely reasonable. Range of 77 to 138. Now, at time 2, things get really interesting because the verbal score decreases by 1 point, the performance score decreases by 2 points on average, and the total IQ decreases by, on average, 7 points. So that at time 2, 3 years after the initiation of treatment, the total IQ score was 93.1. For the same group that had an IQ score on average of 100.2 before. Now, the standard deviation also came down a little bit. So it seems to be quite heavily weighted in a way for those more extreme scores to come down. So a little bit of this might be regression toward the mean. It's possible that test retest, you basically find if you test somebody and then test them again later on basically any metric, if they are extreme on the scores on the first test, they are likely to become less extreme on the second test. So scores will all regress toward the mean. So there's a little bit of that, but I do think this is it's a big drop, right? To go from an average of 100 to an average of 93 is a big drop on, and these young people only experienced pubertal suppression. Now, it's really difficult to be able to draw any firm conclusions here. It's a small sample. It's not statistically significant, and the authors don't consider it clinically significant. But we're going to look at other research, and we're going to find something similar in other research. I do think there is something relevant here that we need to be thinking about. So the next study is Wanyuts and colleagues, cognitive, emotional, and psychological functioning of girls treated with pharmacological puberty blockage for idiopathic central precocious puberty. Central precocious puberty in Frontiers of Psychology in 2016. They took the clinical records of girls with idiopathic CPP, which is central precocious puberty. Idiopathic simply meaning they don't know what caused it. Treated with GnRH agonists, these puberty blockers, between November 2009 and December 2011, either at the University Hospital Ghent or the University Hospital in Brussels. They reviewed them all. Now, they basically identified as precocious puberty as the onset of breast development before the age of 8, accelerated growth velocity in the months before diagnosis, advancement of bone age by at least 1 year compared to chronological age, And participants had to be at least 9 years of age, because the test package is quite complex and they needed children and young people to be able to complete the tests. So they had to be at least the age of 9, and they needed to be treated by GnRH agonists for at least 6 months. So they ultimately ended up with only 15 young people in the sort of precocious puberty group who were treated with GnRH agonists, these puberty blockers, for at least 6 months. And they had 15 healthy controls matched for age. And so they had a sort of control group who were not treated with precocious puberty, but of the same age. So precocious puberty, 15 young people, all treated with puberty blockers for at least 6 months. Controls, 15. The total IQ of controls was 101.9. Which is, just ever so slightly higher than you would expect, but it's only 15 participants. There's not very many. So 101.9, pretty much what you would expect with a total IQ score. Performance IQ of 103.2, verbal IQ of 101.6. They used the whisk again, the same measuring tool as we saw before. And the total IQ for children with precocious puberty treated with puberty blockers was 94.1. So again, this 7-point difference, right? Exactly the same difference, essentially. Performance IQ, 96.8 compared to 103. Verbal IQ, 98.4 compared to 101. Again, small sample, but it is significant. So the total IQ and performance IQ are significantly different between these two groups. I mean, significance isn't everything, particularly when we're looking at multiple studies, but it was significant here, even in a relatively small sample. Now, 94.1 compared to 101.9, to me, is a big difference. I mean, that's not nothing. That's not nothing. Now, I don't think the authors considered it to be particularly meaningful, this difference, but it's not nothing. It's not nothing, I think. These are children with precocious puberty, matched for age. So having been on puberty blockers for a certain amount of time had an impact, it seems. I mean, we can't be certain here, right? It's only 15 children. It's possible that children with precocious puberty started with a lower IQ score than controls in this sample. It's not anything to do with puberty blocking medication. But considering the other research in the field, it certainly raises a question that I think should be the attention of research, much more research than it is the attention of. This is not something that I think should be ignored. I think Professor Baxendale is right that, we're talking about precocious puberty. These are young people who would have had puberty earlier than normal, and the puberty blockers just prevented them from having puberty earlier than normal, and still, it seems, on this very weak-ass evidence, it seems that there might be an impact on cognitive development. It's very weak evidence. You definitely can't draw conclusions here, but we can absolutely suggest this needs more attention in the research, for sure. Now, there are only 3 other studies I could find that looked at pubertal suppression and cognition in some way. The next one is Staforcius and colleagues in 2015. 10 years ago, where's the research? Puberty suppression and executive functioning, an fMRI study in adolescents with gender dysphoria. So looking specifically at folks with gender dysphoria, which is super interesting. Now, they used some very cool approaches here. They got adolescents diagnosed with gender identity disorder according to the DSM-4. They drew in adolescents from the VU University Medical Center in Amsterdam, and they used pegs and beads as a sort of cognitive test, essentially. It's sort of an interesting approach, basically. They got pegs of three pegs of different heights, and the beads on the pegs, you have to move from one configuration to another configuration, one bead at a time, not transgressing the rules, like you can't put bigger beads on smaller beads or something like that. And the question is, how fast can you solve the puzzle? And how accurate are you in your solution? And how many moves do you use to get from point A to point B, right? So essentially, how quickly can you create a plan, enact the plan, and how accurate are you in your enaction of your plan to to solve the problem within the available time frame. This is a pretty cool task. They also did, of course, the whisk as well to get IQ scores, which is really interesting. And they brought together like as many people as they could do. They brought together young people who were gender dysphoric. So they brought together 22 trans-masc young people, of which 12 were using puberty blockers and 10 were not, and 18 trans-femme young people, of which 8 were using hormone blockers and 10 were not. They then brought together as many controls as they could find. Some of them, like a few, were siblings of participants, but most of them were friends of participants, essentially. So they've got 24 young people assigned female at birth and 21 young people assigned male at birth, who were the control group, essentially, of the same age. So roughly these participants were just before or just after their 15th birthday. So around 15, 14 and a half. And they did check their IQ development, and they found something really interesting. So the IQ of the young guys in the sample, young people, cisgender guys, was 110. The IQ of cisgender girls in the sample, 103. The IQ of untreated male to female young people, that is trans femme young people, untreated, 109. Basically the same as the sort of male controls, if you like, right? And those suppressed, the sort of young trans femme, assigned male at birth, transitioning to female on puberty blockers, their IQ was 94 compared to the 110 of the sort of untreated male to female sample, which is huge. Big difference, right? There's a big difference. And when we're looking at female to male young people, 97.1 on average, untreated 98.5, on puberty blockers 95.8. So the authors don't think this is clinically significant, I don't think. And I'm fascinated by it. I mean, I am absolutely fascinated by this. Again, it seems that puberty suppression does have an impact on IQ. Again, we can't know that here. A very small sample, which is what the authors kind of say, listen, there's only 8 people in this suppressed group with an IQ of 94. So we can't know that this isn't just a quirk of the data. And for sure, that is true. But this is like the third sample we've looked at. It's only 3 pieces of research we could find, and they all show a small but not insignificant, small s insignificant. It's 94 compared to 110, even 94 compared to 100. It's not nothing, right? It's not nothing. So again, another study that seems to find that it might impact IQ development. And then Arnoldson and colleagues in 2022, association between pre-treatment IQ and educational achievement after gender-affirming hormone treatment, including puberty suppression in transgender adolescents. Arnoldson basically took a look at 72 participants, 45 trans men, 27 of trans women, and basically looked at their IQ before treatment, and then they didn't look at their IQ after. They looked at their educational status. So they looked at whether people were basically vocationally educated or higher vocational education or academic educated. So they looked at people, the likelihood that people went on to higher education, basically. And they found that the relationship between the early IQ scores and the educational attainment of these participants did not change as a consequence of transition, basically. Now, the French review used this study pretty heavily. This is the study they used to basically evidence that this, the relationship between IQ and educational outcomes is not changed by hormone blocking or gender affirming hormones generally. But I don't think this study is a very good study to carry the weight of that conclusion. I got to tell you, I got to tell you, I just don't think it is. Let's take a look in a little bit more detail, and maybe you can draw your own conclusions. So these guys brought together 72 participants, 45 trans men, 27 trans women. and they brought them together to take a look at their IQ at baseline. They used the WISC, which is the Wechsler Intelligence Scale for children, or the WICE, which is the Wechsler Adult Intelligence Scale. Everybody's loving the WISC as an opportunity to measure IQ. There are other options, you guys, but hey, it's a great assessment. What am I talking about? And they basically took those early IQ scores and then gave them a survey like 7.6 years later on average, and asked them about their experience of education, and they asked them a bunch of other stuff. They didn't repeat the IQ assessment, which is a shame, I think. Would have been really good to know. But what did they find? Well, they found a correlation between pre-treatment IQ and post-treatment, which is post-gender-affirming hormones and puberty suppression and gender-affirming surgery. They looked at the sort of post-treatment educational achievement, and they found, a correlation, pretty strong correlation, 0.71 between pre-treatment IQ and post-treatment educational achievement. And that is basically similar to a greater or lesser extent. In the wider literature, it ranges from 0.49 to 0.81, the correlation between IQ and educational achievement. So the correlation here of 0.7 is sort of in the ballpark average range as you would expect. So I think what we can say here, I think what this study can say is that there is no dramatic change in how early IQ impacts academic achievement. These people are not drastically falling out of higher education. I don't think it can tell us much about the impact of puberty suppression on IQ, given that they're also looking at gender affirming hormones and surgery, and like it's a huge long-term follow-up of 7.5 years. It doesn't really isolate the effects, therefore, of puberty suppression, and it doesn't really look at the outcome on IQ. It just looks at the outcome on educational achievement. So I think it's a really tricky study to be able to draw those kind of conclusions from. And I realize that the French report really leans on it actually a little heavily to draw that conclusion. I'm not totally sure that's fully reasonable. But, what do I know? I'm no expert in this field. The final study is by Strang and colleagues in 2022. Transgender youth, executive functioning, relationships with anxiety symptoms or ASD, and gender-affirming medical treatment status in child psychiatry and human development. Really interesting, 131 transgender youth aged 11 to 21 brought together for a sort of cognition assessment, mental health assessment, neurodevelopmental assessment through a protocol in Washington, D.C. and Columbus, Ohio. So these are essentially 131 transgender youth aged 11 to 21. And of them, 58 were seeking gender-affirming medical treatments but hadn't received them. 66 had already received them. And 29% of those had paused puberty. And 79% were receiving gender-affirming hormones. So, the treatment pathways are not mutually exclusive, apart from anything else. People who are receiving puberty suppression, some of them are also receiving gender-affirming hormones. Some of them stop puberty suppression when they're receiving gender-affirming hormones. It depends. But they looked at the brief 2, which is the behavior rating inventory of executive function. Now, for those who don't know, executive function is essentially your top-down executive control of your attentional systems. So when you try to resist distraction, that's executive functioning. When you try to resist an impulse, that's executive functioning. When you try to hold a lot of information in your mind and manipulate it, that's your working memory system, but it's an executive functioning system that controls that, essentially. So holding information in your mind and manipulating it in some way is an attention-regulated task. And what regulates your attention? It's your executive functioning system. So if you're good at executive functioning, you tend to be better at delaying gratification, at waiting for rewards, at waiting generally. And at self-control and self-regulation. And if you are worse at executive functioning, then you tend to be worse at those things, basically. Executive functioning is involved in almost every attention-regulated activity. Manipulating and managing your attention is what its job is fundamentally. So people who struggle with executive functioning find a lot of things quite difficult, particularly in school, because executive functioning is so prevalent, so prevalently used. So executive functioning is actually really important. So they use the Brief-2 and the SRS-2, and those have sex-based norms which you can compare participants to, and that can tell you, do people who are engaged in puberty suppression and those who are engaged in gender-affirming hormones and those who are not differ in their executive functioning. Super important. So the highlights of the results here, they do find that after essentially controlling for age, assigned sex at birth, gender, anxiety symptoms, depression symptoms, and their autism diagnostic status, whether they were diagnosed as having ASD or not, those in the shorter duration puberty suppression group, people who had been receiving puberty suppression for less than a year, did not have any weaker executive functioning than anyone else. But membership in the longer duration puberty suppression group over a year was associated with poorer executive functioning, which is super important, right? So again, puberty suppression does seem to have an impact on cognitive development. And this is different to IQ, although executive functioning arguably is going to be very correlated with IQ and may be recruited in certain IQ assessment tasks. So they're not completely disconnected from each other. But again, puberty suppression, longer puberty suppression was associated with poor executive functioning. But they find something really interesting because they also were looking at gender-affirming hormones. They found that people who were on gender-affirming hormones for a shorter duration, less than a year, or a longer duration, longer than a year, those who were receiving gender-affirming hormones was associated with better executive functioning and fewer executive functioning problems. So that's really, really interesting. Now, how do they explain this? Well, they say that it's not mediated by anxiety and depression. And they think that what might be going on is that when you receive hormones help relieve the stress associated and distraction associated with gender dysphoria. And so they're saying that it isn't that gender-affirming hormones improve executive functioning, though it could be that. Their theory is that gender-affirming hormones reduce the cognitive load associated with gender dysphoria. If you're constantly experiencing gender dysphoria, if you're constantly distracted by how your body doesn't feel right for you, if you're constantly distracted by how people relate to you in the world as not being affirming to how you experience yourself to be, then that is going to weaken your executive functioning because that is a cognitive load that is filling your mind. While being on hormones relieves the stress, not all of the stress right away, one of the co-authors writes, but I felt like a weight was lifted off me and I could think clearer. So their theory is that gender euphoria and the relief of gender dysphoria reduces the sort of cognitive load that impedes executive functioning. But it could also be, and this is your favorite little podcast host here making her own theory, it could also be that gender-affirming hormones have an impact on cognitive development by putting people through a puberty, by starting puberty. And therein lies, I think, the real challenge. Because overall, we find, I think, that puberty suppression does, maybe, I can't draw any serious conclusions here. There just isn't enough work, right? Literally 5 freaking studies in the last 25 years. 5 studies. Given how frequent precocious puberty is treated with puberty blockers, I'm surprised that there's only 5 studies. And most of them are not on people with precocious puberty. But what limited evidence there is does raise some questions about pubertal suppression and its impact on IQ and its impact on executive functioning. Maybe its impact on cognitive development more broadly. I have absolutely no idea. Just what has been measured, it does seem that pubertal suppression might have an impact. I can't be certain because these studies are tiny and there's only 5 of them, and there's no way to know. No way to know. That none of them are of high quality. You know, if we were going to look at the sort of University of York's standards of evidence from their meta-analyses for the CAS review, none of these studies would score highly. They'd all be extremely low quality, right? Tiny studies, very limited ability to answer this question, but it's the only evidence that's available. And of the evidence that's available, it seems to find a consistent effect that puberty suppression does have about a 7-point impact on IQ. I don't know, and that's talking very broadly. Does that mean that it affects people at the upper echelons more significantly, and their IQ gets more severely impacted, and therefore that brings the average down, and it doesn't affect most people? Or is it everyone? Or is it? I have no idea. You know, you might be able to hear the frustration in my voice. As well as my cold, which is ironic given I'm trying to do voice training simultaneously. But listen, there is no evidence here. There's just no, I can't tell you. But the evidence that is there does raise some real questions that we need to answer. And gender affirming hormones do seem to have positive consequences for executive functioning. And does seem to have a positive consequence for IQ too. Karalexi and colleagues in 2020 conducted a piece of research they described as gender-affirming hormones treatment and cognitive function in transgender young adults, a systematic review and meta-analysis in psychoneuroendocrinology, which is a really fun word to say. They did a huge systematic review and meta-analysis summarizing evidence from 10 different studies, all looking at transgender young adults and the impact of gender-affirming hormones on IQ. And in these 10 studies, they find that they're mostly longitudinal. They are cross-sectional in design, which isn't ideal. They're not prospective. They focus mostly on visuospatial ability and on verbal memory. So there's a bit of a bias towards like sex-typed abilities. Visuospatial memory is supposed to be better in boys generally. And then they take a look. And I think verbal memory is supposed to be better in girls generally. They don't quote me on that. The results showed a statistically significant enhancement in visuospatial ability in people assigned female at birth, that's trans guys, following gender-affirming hormone treatment. So trans guys got better at visuospatial ability after gender-affirming hormone treatment. That is after going through a masculine puberty, essentially, right? Now, they looked at pooling cross-sectional studies, and they found that they showed overall an improved performance in verbal working memory among treated compared to non-treated assigned male at birth individuals, i.e., verbal working memory, which I think, if I'm right in thinking, generally speaking, is better in girls. People treated with gender-affirming hormones, trans girls, become better at verbal working memory, significantly better in verbal working memory. So what we can say, certainly what this systematic review highlights, is that gender-affirming hormones do not have any significant adverse effect on any cognitive domain. Super, super important. That's the strongest evidence we can find. So what we can say here is that pubertal suppression might have some consequences for IQ and for executive functioning. It might have consequences for cognitive development. But that gender-affirming hormones has positive consequences for executive functioning and for some IQ domains, right? Does gender-affirming hormones ameliorate the IQ impacts of pubertal suppression? I have no idea. Do the IQ effects from pubertal suppression at critical periods of development have lasting impacts, regardless of the effects of gender-affirming hormones? Or do the timing of gender-affirming hormones matter for the cognitive development of young people? I have no idea. My theory, so here's my best swing here, right? Having read through all of this research and listened to and read Professor Baxendale's incredible systematic review and meta-analysis, right? I took a look at her systematic review. Actually, I don't think it was a meta-analysis. I think it's just a systematic review, but it's still amazing. Having read all of this research, here's what I think is my best guess of what's going on. Puberty is actually really important for cognitive development. The timing of puberty is also really important for cognitive development, in that the sort of central nervous system becomes less impacted by puberty the older a person gets. Which means that pubertal suppression creates complicated consequences for IQ. Now, it seems that it might have an impact on children with precocious puberty. I don't know if that impact is long-term. I don't know if it's ameliorated by after, actually going through puberty ameliorates that effect. I would hope that it would, but I have no idea. Now, this is why I think it becomes really important when we're thinking about the French approach to gender-affirming treatment compared to England. Because England has been engaging in a watchful waiting approach. We will delay as best we can in order to make sure that a person is absolutely certain about what puberty is right for them before they go down it, given that the effects of puberty are largely irreversible. Whereas the French approach is a more individualized approach that says we give people access to the puberty that's right for them at a time that is right for them based on their decision, the decision of their doctors, and where they are in the stages of puberty. Now, in a watchful waiting approach, people are going to be on puberty suppression for longer, right? It's a pause in puberty that we then will go down gender-affirming hormones later when they come of age and when they can be sure, when they're old enough that we can be sure that they are sure. Whereas the French approach might be to offer gender-affirming hormones a little younger, so young people might be able to go down a puberty that's right for them at an age that's a bit more typical. Now, in those two different approaches, this very weak-ass, tiny amount of research might have different implications. Let's say that more research comes out, we have a bit more of a good sense that puberty suppression does have an impact on IQ. Small but significant, 7 points. Now, if it does, then the argument might be that we should be giving puberty, we should be helping young people to engage in gender-affirming hormones younger, not later, right? Because we should be helping people to go down a puberty that's right for them at an age where their central nervous system will respond more adequately. Whereas delaying gender-affirming hormones, lengthening the time they're on pubertal suppression, might have a longer-term impact. Let's say that gender-affirming hormones do ameliorate the effects on IQ, then we want that to be as quick as possible, right? Because otherwise they're going through education with effectively an effect on their cognitive development, which is problematic, right? Which is going to impede their abilities in education. Whereas in the French system, young people are getting gender-affirming hormones a lot earlier, and maybe therefore the impacts on IQ are less significant. That is a pure guess. A pure guess. I have no way to know what is happening in this field. There simply isn't enough research. What I can say with certainty is that pubertal suppression might have some consequences for IQ and executive functioning. That is not ruled out by this research. Gender-affirming hormones do more concretely have positive consequences for executive functioning, but very much positive consequences for IQ, generally speaking, right? And particularly on visuospatial ability for trans guys and for verbal memory for trans girls. That is much more robust in the systematic review and meta-analysis. So, gender-affirming hormones is good for cognitive development. Puberty suppression, might, I don't know, might be less good. I have no idea. But certainly what is true is that it is. I think Sophie Baxendale, to answer Professor Baxendale's question, I think she's right. I think there is a bit of a scandal here that we haven't, like, and it's nothing to do with trans kids, right? This is about precocious puberty. These 2 studies, are you kidding me? 2 studies? I'm losing my mind. 2 studies on precocious puberty and the effects of puberty suppression on IQ. We have no idea. This is a huge, I don't know how many people, but probably a lot of people are engaged in puberty blockers to prevent precocious puberty. And there's really no way to know if that has an impact on IQ. Maybe they would still have done it. Maybe it's still worth them doing it. Maybe it's still the right choice for them. But it's very difficult for them and their families and doctors to make that choice in an informed way if we don't know what the impacts are on cognitive development. And we absolutely should have more research. And for sure, it has implications for the trans community too. But overall, I think what we should be saying to Professor Baxendale is, yeah, I think this is something of a wildness. But my conclusion here is not that we should prohibit access to puberty suppression. My conclusion here is that the French approach and approaches around the world, England being something of an outlier, are much more appropriate here because they give access to gender-affirming hormones at younger ages. When children and young people know who they are, they know who they are. And for sure, the French review highlights that retransition rates range from 1% to 6%. And for sure, young people do get it wrong. They do get it wrong. They do experience regret, as do all people engaging in any medical treatment. All people are going to experience some regret, either because they made the wrong decision, or because something has changed, or because the outcome isn't what they are hoping for. But a rate of 1% to 6% is still exceptionally low. And so the French review highlights that we should be giving young people access to these treatments responsively. And in so doing, we create a space for young people to be their full authentic selves in the world, right? To be able to grow up as their authentic selves, experiencing a puberty that's right for them at a time that is a bit more typical, that's right for them. So if we follow the French model a little bit, creating a more responsive health system available to children and young people who are gender diverse, if we create opportunities for children and young people to be themselves in the world more fully, and if we ban conversion therapy, France already did it a couple of years ago, England's lagging behind, then maybe we can create a world where everyone can find a place to belong. Thanks so very much for joining me. It's fun to be back, you guys, isn't it? It's wonderful to be here. This is Classroom Psychology. You are very, very welcome here, as always. And I look forward to seeing you, as always, in the next one.